Hello, guys. This is Bridget Ezobiako, and this is Bridging Healthcare. Thank you for coming back again and again to my channel. If you have not subscribed to this channel, I think this is the best time now for you to hit the subscribe button, hit the bell on the side so that every time I come online, you will be one of the first people to know. You can join and you can be the first people to learn from the goodness that I bring to the screen. My name is Bridget Ezobiako, and this is Bridging Healthcare. And the purpose of this channel is to help healthcare professionals to be good at what they do, to be professional. And today I want to discuss something that is very important in my mind and in our skill that helps us to be, I see it a lot. When I look at individuals, when I read their reports, I'm very disappointed and I really want to address it. So in report writing, today, I want to talk about report writing. When you are reporting an incident, when you are reporting your shift, what happened on your shift. I noticed that a lot of support workers and care workers, we are not detailed in our report writing. And we write it like an informal report. So you are writing your report and you just start with this, where the staff, the care, he woke up, he had tea, he drank tea. So staff fed him. So staff did this. Who is staff? That's my first question. Who is staff? That is not person-centered. Your report writing must not only be factual, it must be legible, it must be person-centered, it must be detailed, and it must reflect everything that happened on the shift. You are not there in your personal capacity. You are there in the capacity of a professional setting. You are there as a support worker, and so your report must be detailed, because if you did not report it, it did not happen. I always advise that you report on the 15-15 minute basis what happened. Start with how you accessed the property. Did you knock? Did you use the doorbell? Did you access the care home via this? Even if it's a care home, how you started your shift, how you met your service user. How were they? Were they looking well? Were they looking tired? What did they say? Document it. Then you go ahead to talk about how you started your shift, what you did, and then you now start reporting. If it's a long shift, you now start reporting the chronology of the shift. They came to the kitchen, they were looking a bit tired, they decided to make their tea. I supported with turning on the kettle, not staff supported with. I think that is a very unprofessional way. Remember, your report is a legal document, and if there's any issues and they need to trace or investigate, your report is an important tool. So imagine your typos in your report. Imagine you type and you don't type correctly. Some people will even copy the same note from yesterday and just copy it into today. There are no 2 days that are the same. So you are being fraudulent because you are being lazy. See, reporting is a big part of our work. And so you can't even be lazy about it, because it expresses what you did on that shift. It substantiates what you are being paid for. It also explains to the local authority, to the management, what is happening with that service user. And those that do the auditing and the compliance can actually tell. And the care plan can be tailored to meet. So that's why everything must happen. Must be in your report. I've seen people that had incidents and they could not substantiate their incident in the report. She was just getting heightened and heightened. What happened? What was the precursor? What then happened? What did you do? What was the outcome? Was there any bruising? Everything must be detailed. So today, when you go to work, make up your mind that I will not just type without thinking. I will actually look at my report when I finish typing. I will reread it and I will proofread it and I will check that there are no typo errors, and I will make it interesting for the reader as well. The truth is that when somebody is reading your report, it should be as though they were there when it happened. That is how to be fantastic at what you do. So this is the point for today. When you're doing your reports, make sure you start from how you met your service user, what their outlook was, what they said, and don't say staff said, because you're staff. I said, all right, or she was supported with. Then Make sure that you are detailed. Make sure that you follow chronology. This happened, and this happened, and this happened, and this happened. And then at the end, explain how you left the service user. Is important, because if after you left an hour later, somebody comes and the service user has passed away, they will ask, how did you leave? So you explain how you left. They were sitting on the chair, they were comfortable, or they were watching TV, or I left them the care of their family, or I handed them over to the next staff. All these things are important. They come together to make you great at your job. Now, you've done a shift. Nobody will be able to maybe rewind your shift, but your report will be able to explain your shift. That 10 years from now, we can tell what you did on that shift. I hope this has been able to help. Anyway, I want you to continue to be fabulous at your job and love what you do. We are fabulous people. This is Bridget Ezobiako, and thank you for watching. See you in the next one. Bye.